I will say though, yesterday, I think I saw someone had published trajectories of cases and, cause they look at when you first get your 100 cases and then doubling rates after that. And so I think yesterday was like the 20th day since 100. And we, as a country, bypassed China and Italy for our trajectory. So that was not good news. I think a lot of that is because we have these really populated areas like New York that have now hit. So, I mean, we're less than the worst case scenario, but and who knows if China's data was all correct, but it looks like our trajectory is higher than, and it's steeper than some of these other countries so far.
So just the protective measures we're taking, which are increasingly aggressive, probably could have been more aggressive on the front end. So for like people in Rangeley, it's different, right, than in a metropolitan area where you've got so much density that there's the potential for it to spread a lot easier. What would be the message for our constituents if they ask, are the protective measures that the hospital's taking, the college is taking, the public schools are taking, are those sufficient to calm nerves that, it's probably not going to be as substantial as it would be in a more densely populated area, or is it too early to say those kind of things?
Do you want me to answer?
You go ahead.
I think it's really tough, and I think I'm gonna be talking about it a little bit later, and that is like one of the most common questions that I get is, what is our projected outlook in Rangeley? And, the tough thing is I feel like I'm an auto mechanic who has only worked on, BMWs, and somebody's talking about like, I don't know, Fiat. Like, I really don't know the car. I don't know if that's a good analogy. I'm not a car person. I'm really not a car person. But like, for us, I haven't seen it yet. So we really don't know what it looks like. And the scary part about it is that it can multiply so quickly. I think not being a highly dense area, I do think that's why you see on the maps of Colorado why the northwest corner up until today with Moffett County was totally white with no cases, is because we like going out to our goats and our cows and not other people. But that doesn't mean that if we start school again, or if we were to, put people in the same auditorium, or, that we wouldn't just have a wildfire, because we don't have the capacity either for 200 people to get sick at the same time. So
one example of what we're doing is anybody at our facility that has children that aren't completely healthy, maybe have some immune deficiencies, we've just given them time off. They just are home quarantined. And then starting Monday, we start our phase 2 where we take temperatures of everybody that walks through the door. If they're 100 degrees plus, then they get sent home for 2 weeks. Restricted all travel out of the county. If anybody travels out of the county, they're off for 14 days, so quarantine. So
I think, the biggest question everybody has is, are we being because we are in this, a sparsely populated area, are we having to take these extremes? Is that necessary? And I think we have to have a message. And with that, you're going to talk about the emergency operations that started. That's what we need to have, is a clear message. And that's why I wanted Dr. Abby to be here tonight to answer those questions. So we don't have people out there saying, well, I don't have to do this because I think it's a farce, or I think it's overblown, or I think, yeah, it might be, but at the same time, it's very serious. And I wanted you to talk too, you shared yesterday about some cases that were pretty, severe things that happened. We talked about somebody that died. They didn't know they were isolated themselves. They were self-quarantined. They ended up dying because they didn't get health care. They didn't get things they needed. So this is a serious thing, and we have to take it serious because nobody knows who has it. Nobody. I mean, we could all have it right now. We don't know it, but because it takes a while for it to show up. So But you opened my eyes yesterday when we were talking about how it's not even close to spiking yet in Colorado until another couple more weeks. That's why they're doing this lockdown. They want to try to prevent that spiking to happen.
And for us in Rangeley or the outlining communities, it's just gonna hit a little bit later. So, it'll take its time to get here, but it's not a matter of if, it's when, so.
And that's kind of by design, so that once it's gone through the big cities, hopefully once it hits us, we have some beds open up where we can transfer higher acuity, I can't talk tonight. And also some ventilators open up. Because if it hit us the same time as Junction and Denver, we have nowhere to send our patients.
And that's the thing, if, we only have, let's say, 15 patients that get it severely, we can't handle 15 patients here, right? It's hospitating to those few patients, because we don't have a facility to handle those things, so.
Yeah, so I mean, I think the message, because one of the things you asked is how well are we prepared? I think I want people in Rangeley to realize that, like, if you were to get COVID, I think this is a great place to get it, because we have amazing respiratory technicians. We have a CNO and a CEO who are new and young and energetic about taking measures to take precautions. We have our CEO who's in charge of labs. So that means when we need to get these COVID tests, they get done, which is really, really important. Our physicians and nurses, and our pharmacists, we've all been working really hard to try to get the supplies that we need. And I think, there's still things that we worry about, because in a worst case scenario, you can't have, 300 times of everything as a spare in a closet in a small town. You just can't. Like, it doesn't make sense financially, but I think we've prepared ourselves well with good equipment. We have a new portable x-ray. We talked about that at the last board meeting. We've gotten these 2 high flow oxygen things that we originally thought we couldn't use with COVID, but there's been more data about those now that we can use them as long as we have a contained field for the patient. So some of these purchases and things that people question the cost for a small community, auspiciously, we've gotten this pretty new facility that has things that are up to date, that are going to be top notch, in terms of technology. So, and we've been judicious with our testing and our protective equipment so that we will be prepared. And I think in terms of the preparations that we've taken for the facility to lock us down, to keep our patients that are basically permanent inpatients here safe, are gonna be protecting them. We have telehealth now, so that people who are sick, who are minorly sick, we can take care of them at home, and no one's gonna bat an eye if I prescribe antibiotics and I haven't actually looked in your ear, or I haven't actually looked in your mouth if I think you have strep. Right now with the pandemic, we could do all that on a computer, on a phone, and take care of people without having them walk through our facility with a fever or with these things that, unless we do COVID swabbing, we can't be 100% sure that they couldn't be bringing in this contagion to us. So, but the real caution message is that, 100 people died in New York today. Like, 100 people. They brought out cold freezer vans to start dropping bodies at one of the hospitals. And what the story that I told yesterday at our med staff was 2 healthcare workers that died in Georgia. One of them was a physician that had self-quarantined at home, and it was a basically welfare check that found him dead and out. Like, so what can happen with these cases that look at mild cold symptoms is they go home, they stay at home and are quarantined, and 2 weeks later their lungs fill with fluid, and you have like this 4-hour window to really intervene. So and that's one of the things that we're discussing, but I haven't actually seen this, like I mentioned, but I'm with a lot of doctors on social media. I have a network of different colleagues that I went to school with and did training with, and they're all telling me I've never seen other doctors get so scared. So, I mean, to me, that's the real caution is, I got terrified when Ebola came out, because that'll kill you, and it is like super contagious. This seems, I can see why people think there's politics involved. with the year that it is, with our current gubernatorial candidate or elector, whatever, I can see why we think politics are playing into this, but if you look at the actual numbers and how fast people can decompensate and get really, really sick really quickly, it's serious. So it's not a small matter. So I think the reality is, yeah, when you look at the death toll going up, we're not so separate. You know, we wish we could be an island somewhere else. A lot of times we wish we could be probably not part of Colorado and maybe be part of Wyoming or some other state. But as it is, we still get a lot of employees with Chevron, with the college, people that are traveling to these high risk areas. So this isn't by any means closed door for us for it hitting. And if and when it does, which the question is really when, is how bad is it going to be? And I think as long as our guards are up and we're really vigilant, protecting our hospital, not just our patients, but these employees as well, so that it doesn't spread, I think we'll be able to be in good stead. But I don't know if that was a longer answer, but that was kind
No,
of what I thought you were kind of
I
planning.
appreciate the answer very much. I think a lot of people probably just need to hear exactly what you just said.
Yeah.
You know, there's been this spectrum, and Keith included, of people go, well, come on, right?
Mm-hmm.
Like, this isn't a big deal to, holy cow, I can't sleep tonight because I'm so nervous about this.
Right.
And probably somewhere in the middle is, this is what we're doing at a reasonable level to take precautions to protect the community. And I think people probably appreciate hearing what you're saying. I know the feedback that I've received so far about just what's happening up at the hospital. I think people are grateful for it. You know, like so it takes 45 seconds out of your life to fill out a little form when you walk in.
Right,
But that's a whole lot better than what the consequences could be if you don't.
right.
And it's a really a small sacrifice in comparison to how bad it could be. I'll say as well, I know you've been a big part of it. I was recently this week had a telemedicine appointment,
Okay,
and it was a fantastic experience.
great.
Like you couldn't have convinced me years ago that I would ever want to go see the doctor over the internet. I won't even do Facebook.
Yeah.
But you know, in a time like this, to be able to literally just take 15 minutes out of my work schedule and sit at my desk and be able to have the same experience that I would have if I would have physically come up here was an excellent experience. And so I appreciate that very much as well. So
Thanks.